certified occupational therapy practitioner, and I'm here because I have experience on COVID units. I've worked on 3 COVID units, 2 isolation COVID unit, and 1 step-down unit. And so I've witnessed a lot of what I guess the media has been talking about, and I see how they've misrepresented the truth on COVID, the truth on the testing. For instance, at my facility, I work at the biggest skilled nursing facility here in Oahu, and I work with the geriatric population. The people that were moved to the COVID unit didn't have COVID. They tested positive with the PCR test, but most of them were asymptomatic and only suffering from their pre-existing conditions. None of them had exacerbated symptoms. Most of them weren't sick other than what they were already dealing with: end-stage renal failure, diabetes, COPD, congestive heart failure, things of that nature. I also saw how some of the hospice patients that were moved to the COVID units that died of terminal illness were actually put on the COVID death list, which is complete fraud. And facilities were facilitating this and doing this the whole time. More people survived and had no issues and were asymptomatic that were well into their 80s and 90s than that passed away. My entire experience on these COVID units, I think there were 12 deaths, and none of those deaths could fully be attributed to COVID. It was all pre-existing conditions or terminal illness. Since the rollout of the vaccine at my facility, Moderna was the vaccine that they administered, I've seen 32 elderly people pass away immediately after taking the Moderna vaccine. None of that is being talked about on the news. None of that is being spoken about on the media. It doesn't fit their narrative. I've seen more people pass away from the vaccine than I have on COVID units, which is really weird, seeing that supposedly we have really high COVID case numbers. A lot of the patients that I treat are suffering from stroke and heart attack, hip replacement, knee replacement, things of that nature. So when these people get admitted to the hospital, they have to take a PCR test first. So someone experiencing a heart attack will be picked up by the ambulance, taken to the hospital. The hospital will administer a PCR test. If the PCR test comes back positive, they admit this patient as a COVID patient. They don't admit them as a heart attack patient.